Hi everyone, I'm Shireen. Today I'm going to tell you about the type of the fracture and method of the treatment. So, what is a fracture? A fracture is a broken bone. Fractures are usually caused by trauma, such as the fall or accident of the car. However, some fractures are caused when a bone is put under constant and repeat stress. So, for example, you may have heard of the distant runner being diagnosed with a stress fracture in the small bone of the foot. Think about how many times a runner's foot pounds against the pavement and the force behind each step, and you will understand how the stress fracture can occur. So, other fracture called pathologic fracture occur in bones that have been weakened by a disease process, such as the osteoporosis or bone cancer. So, all people are especially at the risk of the fractures because the bone become more fragile with age. Other people are almost likely to have distance that put them at the risk of the fractures, such as osteoporosis or bone cancer. Weak crystal bone can fracture easily. Often the form are seemingly minor fall or stumbling. For example, hip fractures are quite common in the older women who have fallen just a short distance, such as from a standing position to the floor or sidewalk. Not only do the bone of the older person fracture more easily, they take longer to heal, and they may heal improperly, and delay or improper healing may cause prolonged difficulty with the mobility. So now I'm gonna tell you about the type of the fracture. Type of the fracture can occur in the almost any bone in the body and our classification in the following manner. Actually, it's have like a 10 type, but now I'm gonna tell for the 5 type. So now. So for the first type is called closed fracture or stable fracture. The bone is broken, but the broken end do not protrude through the overlying skin. So for the treatment, since this type fracture doesn't require the realignment, the doctor will simply mobilize the bone with the cast. The patient may take the medication inflammatory to alleviate pain. Next, open compound fracture. The bone is broken and the sharp end of the broken bone have broken through the skin. Because the skin is broken, open fractures carry a very high risk of the infection. So, for the treatment of this type of the injury and emergency, more likely than not, the patient will require the surgery to clean the area, move the burrs, and stabilize the fracture. The patient will need a tetanus shot and antibiotics. Next is called green stick fracture. Have you ever tried to snap a young green twig? Unlike a dry brown stick, a green twig will bend and splinter, but it will not break all the way through. In a green stick fracture, the same thing occurs. The bone bend and splinter, but it does not break all the way through. The green stick fracture occurs mostly commonly in the children because the bones are still quite inflexible. For about the treatment of this type, if the bone is bent, the doctor will manually stand it, and the patient can wear a removable splint as opposite to the cast. So, the next is called impact fracture or maybe called transverse fracture. The bone is broken all of the way through and the broken ends of the bone are jammed into each other. These fractures are often seen in the people who have jumped or falling from a height. For example, off of a roof or ladder. So for the treatment of this type, the medical provider will relay the bones through an open reduction internal fixation. Once the bone fragments are aligned, a traditional cast or splint will be used to immobilize the bone. Next is a common head fracture. The bone is split into the several little pieces. This type of the fracture is common when a bone has been crushed under a great weight. The surrounding tissue, as such as the muscle and skin, may be serious injuries as well. So, for the treatment of this type, due to the bones being the fragment, this type of the fracture requires the surgery in order to prevent additional damage to the surrounding organ, like nerve or maybe ligament or artery and veins. So for the treatment of this type, the healing process of the spiral fracture is very complicated than other type of the fracture because the twist of the motion results in the jagged edge on the bone. Surgery is required into the most case to the realign the bone and set them back in the place with the straw. Maybe pins, maybe all roads. Post-surgery, the patient will wear a cast or undergo physical therapy before returning to their regular activities.